You can catch the full course on wellnessplus.tv and Amazon Prime. Hi, I'm Robert, and this is our yoga massage course. I'm going to show some techniques that you can use for gluteals and hamstrings, the back of the body, while the receiver is prone or on their front. We're going to have Lucy be our model to receive for this first video. We're going to have her lay down on the mats, face down with her head that direction. And scoot over to the center of both of these mats. When you lay down and put your arms by your side with your head to the side, I want to find out how that feels on your neck and head. Is that comfortable there?
Yeah, it is.
Okay, so at any time if you decide you want to turn your head to the opposite side, it doesn't affect what we're doing. And I think what I'm going to do is I'm going to demonstrate first and then we'll have you take over. When I work on the gluteals are large muscles here. What we have is the sacrum that goes down to the tailbone. So the tailbone is where it connects. All of this here is bone. There's a little bit of skin on top, but mainly what I want to do is work the muscles on either side. The way that I'm going to work those muscles initially is to give her a little bit of pressure, and what I want to check on is how her hips feel in the front. So when I come in and apply some pressure like that, is that too much on your hips, on your pelvis?
No.
Okay, now if I give you a little more pressure, there's tenderness where I'm applying pressure, correct?
Yeah.
Is it too much in the front?
No.
No, okay. If at any time we're working, if you start to feel pressure in the front, I want you to tell me, okay?
Okay.
So what I'm doing is I'm maintaining balance with my right foot. I can stand on the mat, I can stand on the floor, it doesn't matter. I want to be able to use my left foot in this case. Come right in, and I'm jostling around those structures, and I can tell this is already pressure. I got to breathe and breath out of her. I heard that. She's like, ooh, tender, tender, tender. And this is from yesterday, right?
Yeah.
So this little bit of jostle, because she has some soreness, is how we're going to start this. One of the interesting things that happens as a massage therapist and yoga instructor is when I'm working with female students or clients, this is totally permissible. You can see that if I was using my hand, would this feel a little more uncomfortable to you, Lucy?
Yeah, sure.
Sure, because there's some strange guy touching your butt, right? But when you use your foot, it has a slightly different energy signature, and I don't want you to be nervous about that. If you decide that you don't want to apply direct pressure with your foot, you can come in with a blanket or towel. They are now covered, and you can do the same thing through the towel. Also, if she's inordinately sore, that's going to dampen the pressure. It's not going to be as sharp. How's that right? Aha, exactly. Now, I use that just to demonstrate, and I give her just a little bit too much pressure just to show that initially. But we're right along the sacrum on this side. I want you to come in and do the same. Lindsay can use either foot. It worked best for me to use my left, but you tell me, you want to feel your foot conform and mold around her sacrum. You're getting pressure into gluteus maximus. As you go lateral, a little bit of gluteus medius, and also gluteus minimus. Below those muscles, you have the deep lateral rotators. Piriformis, gemellus superior, obturator internus. Yeah. You can look those guys up, but in the end, you're just working on the gluteals. If you decide to deliver more pressure, after the jostle, you can start to lean in. The ball pad of the foot, this structure is big and broad. It allows a much broader compression than using an elbow, which means that people are more likely to be able to receive that and be comfortable. As she uses a jostle, there's also some movement through the lumbar spine and through the lumbar facet joints, because as she mobilizes, she's starting to let some of this area go just from that movement. When people have low back pain, this is a go-to position for me because I'm able to access this area without putting deep pressure along the paraspinals in the lumbar spine. And if you get tired on one foot, feel free to switch out. Yeah. Now, for Lindsay's movement, she also gets a chance once she feels settled. In other words, once she's picked a spot and she wants to compress. What happens if your arms are out? What happens if you're twisting to one side? What happens if your foot position is different? Think of it a little bit, it's not the same. Think of it as a yoga pose. What's going on with your spine? Because once this is delivering pressure, the rest of her body is free to move around. Because what she feels is the pressure from the foot, but you're able to mobilize and twist through your own spine just to kind of honor your own body in yoga practice. Do you need more pressure? Good, that was what I was checking on. If she decided that she did in fact want more pressure, and if she wanted it to be sharper, she could use the heel, but that's a meaner tool that we're going to avoid for this video. And any way that you want to shift your foot position to broaden your stance, to change it, totally fine. If your foot is further back, it allows you to reach more laterally out to gluteus medius and maintain some stability. But it really does depend on you. The other thing is when you put your foot down, you just want to make sure you don't get on her arm here. The gluteals are large muscles that do tons of work. I will often show you in our yoga massage course how you use a tennis ball to access some of these same muscles, and that puts Lucy in control so that she can work on herself in addition to the yoga massage we're showing you now. This is really great for a yoga class. If you are a yoga teacher and you have students who are struggling in Cobra, and they're struggling in upward bow, and they are working, and you can tell they are beat up and tired. You can come along between pose and just do this for 30 seconds on one side, 30 seconds on the other, just to get them to soften up, relax, release, unwind, and then let them go for another pass of the same yoga pose. Lindsay is starting to vary her position naturally. You'll notice that I did not tell her to do that. She just naturally starts to think of her feet as an extension of her body, and she's feeling now with the outer edge towards her pinky toe to say, how can I deliver pressure here? Because she's looking for a spot that feels like it gives Lucy adequate pressure, but it has a certain sort of structural integrity. It doesn't compromise her body. It doesn't make her hold on to any tension. And Lucy, if you get tired and feel like you can't receive anymore on that side, just let me know and we'll switch to the next piece. Doing okay so far? Yeah. If you have to check in verbally with the receiver about pressure, feel free. They don't find it less relaxing. If anything, what I think does happen is Lucy feels like we have listened to her, that we were focused on her and her level of comfort. There is a stronger rapport with the yoga teacher. Yep, because your foot becomes like a forearm or an elbow. It's a different tool, a different set of structures. And what feels good to you? Well, both. Because if you don't both feel good, we got to change it.
Can you feel the difference? Yeah, I can. It feels good though.
Yeah.
Is it a lot more intense? No, not a ton. It's just a little bit focused.
Forearm or fist, right? Different in the structure. When you do that, what do you feel lengthening in your own body? Yeah. More length on her calves. Because a smart yoga teacher works on themselves while they're working on students. She's able to focus in here on this portion of the back of her leg to lengthen that because of her position. What brings awareness to both the giver and the receiver? The little bounce on and off, leaning in, backing off, leaning in, backing off, normally feels good, especially when people are tight initially. I will often also kind of grab with the foot and then kind of shake out, depending on the person I'm working on. I may ask them for feedback if they like one or the other more. They just seem to vary from person to person. Legs getting tired? Gluteals. More hip strength, more core strength, more leg strength, lower center of gravity, bringing your energy center down to Hara and Dantian. Hara is from yoga in Ayurveda. Dantian is from Chinese medicine and acupuncture. Energy center just below the navel. It takes a little time if you're not used to using your legs this way to develop enough strength and balance through here. But the real benefit to a massage therapist is how much are we using our hands? Aha, and here, how much are we using our hands? Aha, because this is a different skill set that prolongs massage therapist careers. So, just to give you a break for a second, I'm going to hop up. We're going to switch it up and we're going to use a slightly different spot. I'm going to stand just to this side of the camera and step my foot in to the hamstrings. How's the pressure there, Lucy? Am I pressing your pelvis into the mat in a way that feels uncomfortable? And what about your knee on this side? Okay. Big, broad pressure right at the gluteal crease right here. I'm right on the hamstring. I'm going to lean in. You tell me, is that too much? Okay. Now, for me to have some balance, I'm able to use a little bit of thumb pad pressure right along the spine here. I can press on either side. And the pressure here is good. Now I can grab this and rock, just like before. Big and broad. This isn't the heel of my foot. It's not the ball pad. It's the big, broad arch reaching across. Are you ready? Semimembranosus, semitendinosus, and biceps femoris. Oh, you have a bicep in your leg? Yes, biceps femoris, the femur. Semimembranosus, semitendinosus, and biceps femoris. You don't want to press directly behind the knee, but you have a good amount of pressure here. If I decide to switch to the opposite, same thing. How's the pressure right there? There we go. And hip, knees okay? Okay. So when I roll you back and forth, is that stimulating your kneecap in a way that feels uncomfortable?
Yeah.
Okay. And that's why I ask. So what I'm going to do is this. I'm going to bring this down. Lift her up, and how's that there?
Yeah.
Now when I rock you there, is that better?
Yeah.
That's what I wanted to avoid. The patella, the kneecap, is just sort of floating around there. If I give you a little pressure there, how's that? Same thing. I'm able to reinforce with my forearm on my thigh. I'm able to stack and apply a little bit of pressure here, just along the spine. I'm looking at her facial expressions just to see if she's wincing, making sure it's not too much or not overly tender. Now, I could stand on this side and use this foot, but you see how my toes are in towards the groin? It doesn't feel like it has as much structural integrity than it does to reach over the body this way. I think that works a little bit better, and then I want you, Lindsay, to go ahead and try that. It doesn't matter which leg you start with. I just want you to work on a little bit of both.
When you were on this side, how did you...
So this foot's down, and then you're going to step this foot across with the toes out right here. There we go. Big, broad arch.
And how is that? Is he doing more? No, that's pretty good. Okay.
Robert was not doing more, but Robert outweighs you by about 100 pounds. Because we're using body weight, right? With Lindsay's smaller, sharper tools, she can use them in a slightly different way. What that means is, if we looked at the size of her elbow and the size of my elbow, the size of my forearm and her forearm, the size of my feet and her feet, the structures are different. Sometimes in class, what I have to do is I have to give Lindsay extra tools because her body size and shape is different than mine. Long term, you want the receiver to be comfortable first, and then once we're doing good work for Lucy, we have to figure out the tool that Lindsay can use to make the work most effective. And I dare say, looking at that, they will feel great. How's that? Yeah. How's the pressure to you? And it's easy on your hands, right? Yeah. If you decide to give her a little bit more pressure, I want to see how this feels. If you bend at the waist and put your forearm down on your thigh, can you bring this hand down to her back? What feels deeper? Does that feel deeper than the other version?
On my leg?
Yeah.
The other one was actually a bit deeper.
And you like that more?
But this was good too.
Okay. But it's also a way of getting you to shift, Lindsay, your spine position so that you have a chance to work on your arm, your shoulder blade, your neck mobility. So as you're doing this, once you feel comfortable, what about your head and neck? Can you spiral around and move it? Aha! That is the long-term sign of a really great practitioner. You realize at a certain point that you're no longer just working on Lucy. You're working on Lucy and then working on yourself. When we think of yoga, not as just yoga, but when we think of it as mobility, movement, embracing movement, yoga is not just about stretching. It's about having enough strength across joints to support and stabilize a joint. The practices of yoga and massage for me broke down and fused into what I call yoga massage, because I could blend and mix and match the work in a way that was more impressive to clients. I was able to help them with chronic pain, and much like Lindsay, I could release my own tension by mobilizing and lengthening my own body. When I get tired of leaning over, I can stand back up again and then deliver pressure as we had started. Sure. And then if you need to, yep, there you go. If you need to move her hand, you can step in. There you go.
Like more or less?
You'll be surprised how quickly the receiver will want you to stand on them. And for most receivers, it's comfortable. For most receivers, the way that you distribute body weight is going to work. For obvious reasons, you wouldn't do this to somebody who is extremely frail, sick, infirm, had osteoporosis. But lighter uses of mobilization, most people who are taking yoga classes could probably receive this. Because she has pants on, we can't see her legs completely. We wouldn't put pressure on extreme like varicose veins. If somebody had like deep vein thrombosis, something along those lines, always remember, if in doubt, don't. But this is comfortable and safe for most receivers, especially when the compressions are lighter. Once you start getting into deeper compressions, you may want to contact me and ask questions. I'm totally happy with that, by the way, because we're trying to provide ongoing education in yoga massage that allows you to get information to work on people comfortably and safely. There we go. The muscles in the hamstrings will taper down towards the knee. I like the big junction, the thickest, meatiest part of the thigh at the base of the gluteal crease, at the very top of the leg. But I don't want you to not address further down on the hamstrings, especially for semimembranosus and semitendinosus and the way they wrap around the knee joint. You don't want to put pressure in the popliteal space, which is right behind the knee. Nerves and nerve clusters kind of run through there. You don't want to put extreme pressure there, but anywhere along the back of the hamstring typically is very safe, as well as putting pressure into the gluteals. Do you want a little more pressure, Lucy? That's good? No more pressure than that? Okay. Thank you so much for joining us in the yoga massage course. You can catch the full course on wellnessplus.tv and watch it for free on Amazon Prime. In my 15 years experience as a yoga teacher and massage therapist, I've blended techniques to be able to help students consistently with flexibility, mobility, and by helping them decrease pain in their bodies. As I work with those students to embody, I'm sharing those same techniques with you in this yoga massage course to help you connect with students, increase rapport, and help students just like I have. You're going to be able to, in following the series, work on yourself, help the students work on themselves so that they can embody, and you can be a rock star teacher for helping students feel comfortable being their own best educator.